And you might notice my vocabulary is a little bit different. I don't refer to births as deliveries, because deliveries are for the pizza guy and the Chinese man. If anybody ever asks me who delivered my babies, I say, oh, I did. If you want to know who caught, that would be my doctor, but yeah. So that's just me. I use lots of different words, so if you're ever wanting to know what I'm saying, just ask. So once you choose your care provider, you want to ask questions. You want to interview them. Don't be afraid to ask questions. So often people just say, oh, well, I just picked this person because my friend Sally Joe went to him and she really liked him. Well, did Sally Joe have the same type of birth that you want to have? Because if she didn't, if she wanted a more medical birth and you want a more natural birth, then that's probably not the doctor for you. So it's important to ask lots of questions and to know that you can switch at any time during your pregnancy. I've had clients who went from a hospital birth to a home birth at 38 weeks. 40 weeks is considered full term. 42 weeks is considered past your due date. How many people knew that? That you're not actually post-dates till you're 42 weeks in one day? One person?
What did you ask?
Most people think that you're past your due date, that you're overdue once you've hit your due date and gone beyond that, and it's actually 42 weeks in one day is considered overdue. A lot of people don't know that, and if you get a care provider who routinely induces at 41 weeks, and you're wanting a more natural birth experience, it's going to make it more difficult to go that route. So it's better to find someone who doesn't routinely induce at 41 weeks. Are there reasons to induce at 41 weeks? Absolutely. There are certainly medical indications, but to induce all women at that point is not it's not supported with the medical literature. So finding a good care provider. Right now, we only have OBGYNs. There's one practice with nurse midwives in it, but they work with a more conservative group of OBGYNs. So that has to be kept in mind. There's a CNM up at one of the hospital in northern Columbus. She works in the clinic and she's great, but only if you're a clinic patient. Hopefully, some things will be changing in the near future with that, but that'll yet to be seen. But if we get lots of requests for nurse midwives, if people call doctors' offices and say, hey, do you have any nurse midwives? That might kind of boost that a little bit. So, and then again, the certified professional midwife route or the lay midwife route is another good option. And there are many here in Central Ohio, and if you want specific names, I can get that to you. Are there any questions thus far? Any of you think I'm completely crazy yet, or? I'm used to that. So the next step in having the best birth possible is finding a good childbirth education class. What do you think about when you think about childbirth education? Lamaze. And what do you think about when you hear the name Lamaze? Yeah, the breathing. Yep. Breastfeeding, that's good. That's nice to hear. It's not your mom's Lamaze. That's kind of our new saying. We're not about the breathing at all anymore. You'll find a Lamaze teacher here and there that still teaches it. She might be an older Lamaze instructor who was trained many, many years ago and just hasn't been able to break that habit.